The next question is, please could you advise on menopause and taking HRT?
Yes, and this is my favorite question thus far today. It is such a relevant question. So, 3 to 1, women have MS more than men. And the average age of people with MS is getting older because people are living a long time and they're getting older. And so many people that I take care of are women who are peri or postmenopausal. And there's been some significant research studying the impact of menopause and perimenopause and MS. So let's throw out some definitions just for a level setting education. When a woman is in her late 20s, her estrogen levels start to go down a little bit. And then shortly thereafter, her other sex hormones, so progesterone and anti-Mullerian hormones, start to go down. Evolutionarily, probably because like we don't need to keep making babies into our 80s or something like this, right? So those levels are starting to drop.
Mm.
And around age 45-ish, women may notice that they're not having a regularity to their menstrual cycle. So whereas before they could set a clock to when they had their period, now maybe it's spreading out, it's happening, it's skipping a month, it's happening early, it's kind of changing. And this is because the estrogen levels are falling. And if you look at the average age of 55 years, most women have stopped having a menstrual cycle. And if you go a year with no period, then we call that menopause, right? Which is a function of the estrogen levels dropping. Whenever estrogen changes during onset of puberty, during menarche in this, during menopause in this example, the MS disease changes its behavior. And when estrogen goes down, MS disease can go up. Now, this has been studied, and what we've learned is in women with MS who are perimenopausal or menopausal, menopause, we see some changes. Number one, the attack rate actually goes down a little bit, which is good. That's great. Number two, the risk of progression goes up, which is bad. Right. So to talk about that for a second, if you look at a group of men with MS and a group of women with MS, the women get worse slower until they reach menopause. Then they get worse at the same rate that men do.
Mm.
Right. Lastly, there are a host of really yucky symptoms which can increase in perimenopause and are very common in MS. So I'm going to rattle them off, and you might be like, well, wait a second, I'm experiencing some of these.
Yeah.
Things things like fatigue, irritability, insomnia, increase in anxiety, increase in depression, increase in emotional lability, increase in baseline of pain for some reason, increase in problems with bladder, trouble with bowels, trouble with sexual function, hot flashes. There's just a host of like yucky things.
Mm.
And the fact that we don't talk about this more bothers me because it's a really big deal and it affects many of my patients. Now, here's the kicker, right? So if I had a drum roll, like I go,
I'm ready for the drum roll.
drum roll is it's treatable.
Yeah.
You can make this better with medicine. And it's actually not medicine, it's hormone replacement therapy. So here's the jam. All right. So this is the secret sauce. I want to put women with MS who are perimenopausal on hormone replacement therapy. I want estrogen only topical hormone replacement therapy. Why? Because I'm trying to replace estrogen. And if I do it topically, there's no risk of blood clot. And if I do it with estrogen only, there's no real increased risk of cancer, like you might see when you do dual therapy. So I really think that's the thing to do. And I recommend that to the vast majority of the women I take care of who are of perimenopausal or menopausal stage.
Wow, that's great. Yeah, okay. That was one for me there. Thank you for that.